This video is sponsored by GuideRight Surgical Guide System, providing a geometric approach to guided implant surgery. We're discussing the mandibular right second bicuspid and first molar, which have no keratinized gingiva or minimal keratinized gingiva and gingival recession on the buccal surface of the molar. You can see the exposure of the implant abutment. Incision is made in the at the marginal gingiva, and a full thickness flap is reflected without a vertical releasing incision to form a pocket for the graft. The marginal gingiva is left. It allows suturing of the crestal aspect of the pregingival graft to that tissue to stabilize it. The pregingival graft is harvested from the palate, sutured to the marginal gingiva. In all these grafting cases, we make an appliance for the patient to wear to cover the donor site as soon as the graft is removed, like a Howley retainer. The graft, anyway, is then repositioned into the bed, which has been prepared. The coronal aspect of the graft is sutured to the marginal gingiva with 6L poly sutures. We leave the ends long, so it's easier to find the ends and remove the sutures after the site is healed. The alveolar mucosa is sutured up over the keratinized epithelial surface of the pregingival graft with a suspensory sling suture for at least 3 days. And the site has healed with a 3 millimeter zone of keratinized gingiva, as you can see on the buccal surface of the molar. The patient has no keratinized gingiva, and the implants in position number 29 and 30. There's been some bone loss. You can see the threads on the buccal surface, and we're going to do a free gingival graft here to try to stop further recession. So a split thickness flap incision is made right along the marginal tissues there, leaving a collar of the original tissue attached to the surface of the implants, the sew to. The surface of the bone must be partially exposed below this in order to prevent the mobility of the graft after it heals. So you need to do a sharp dissection right down to the bone here to be sure it's going to be stable. Free gingival graft is removed from the palate. It's measured, it's placed on the top edge, it's sutured to the collar of the gingiva with 6O poly sutures. The bottom edge is not secured with sutures. However, the flap is pulled up over the graft to stabilize it so the bottom edge will remain in contact with the underlying tissue and bone. Sling sutures, 3L silk, are used, pulling the free gingival margin of the flap over the free gingival graft. Sutures, as you can see, go interproximally between the teeth, come back out, pick it up again, go back in, come back out and pick it up on the distal so that the graft is totally covered by the initial flap of the alveolar mucosa. Sutures are removed at 3 days. If the graft is taken, it's going to be fine to remove them then. If it hasn't taken, you'll notice it. It'll be white and necrotic. Anyway, 3 days is the magic moment. You need to get the sutures out so they don't interfere with the healing. That tissue that you see there, the edge of the flap, will continue to heal down below the margin of the pregingival graft. At 2 weeks, you have a 3 millimeters band of keratinized tissue present at the gingival margin. This is still fairly immature, but the patient's free to go ahead and brush at it at this point in time. And this is the way I handle these situations. This is another case for a patient that lost 2 implants. The sites were grafted with BMP2 and PUROS. However, before 2 more implants were placed, I advised and completed a free gingival graft on the edentulous ridge in preparation for and to restore the keratinized gingiva for the 2 implants. These implants were placed 10 years ago, number 18, 19, and 20. Note the lack of keratinized tissue on the implants in number 18 and 19 sites. The implant in number 20 site appears to be fine. A periapical X-ray indicates advanced periimplantitis on sites number 18 and 19. Sites number 18 and 19 were grafted with PUROS and BMP2 after the implants were removed. Sites were allowed to heal for 6 months. When the patient opens, it's even more obvious that there is no keratinized gingiva present at the alveolar crest. An incision is made along the alveolar crest, extending back the retromolar pad, and a full thickness buccal flap is reflected, exposing the alveolar bone. The donor site is measured with the periodontal probe, and I expect that we will need approximately 20 millimeters of graft tissue here for the length of the alveolar ridge. The graft incision is outlined with a 15C blade before it is removed. Pre-gingival graft was then removed from the palate, approximately 20 millimeters long. It'll be reversed. The thickest part of the widest part of the graft is placed on the anterior part in the number 19 site, next to the bicuspid. Pre-graft is sutured at the alveolar crest to the lingual incision line with 6-0 poly sutures. The ends are left long for easier retrieval. The lingual flap was not reflected. Buccal flap is then pulled up over the pre-gingival graft and sutured to the lingual incision line to stabilize it. This is an anterior shot to show the complete closure of the site. Sutures are removed after 3 days. Finally, the implants are placed using a surgical guide that's been checked with In Vivo 5 software to be sure we're not impinging on the mandibular canal.